So Sheena Jain was a very nice young 28-year-old female who actually unfortunately met with an accident about 3 months before she actually saw me, and had a direct fall on the elbow. Because of the injury, although she did not have a fracture, she was immobilized for about 6 weeks by another orthopedic surgeon in a plaster. And because of the blood accumulating in the joint, plus the injury and the prolonged immobilization because of the plaster, she actually developed a very stiff elbow. When she came to me about 2 months from the injury, of course we decided to undergo a trial of physiotherapy, where I encouraged her to do as much range of motion as possible to get her elbow range of motion back. Her elbow movement was just about 10 to 15 degrees in the mid-arc area. And then she pursued physiotherapy religiously, but had significant pain, and there was almost no improvement in her range of motion of the elbow. It was still about 20 to 30 degrees in the mid-arm area. And thus we decided to undergo elbow arthroscopic release, which is basically we take keyhole incisions around the elbow, and through a camera we get in, see the joint, and release all the scar tissue. So it's a small surgery, but of course it takes time for a patient to decide on that. She definitely took the plunge, and we went ahead with the surgery. On the day 1 of the surgery, as soon as she was out of the operation theatre, she was able to almost completely do her range of motion with a deficit of just about 10 degrees. So she had almost complete range of motion. At about 5 days, her range of motion improved all the more. And then she continued physiotherapy religiously in a very dedicated way. And I think now she's 4 weeks out of the surgery, and she is almost 95% recovery of her elbow range of motion and complete relief in pain. So I think it was a very interesting case, and I would also give credit to the patient that she was able to religiously pursue physiotherapy after elbow arthroscopic release and get this function. So I wish her all the best.
Hello friends, my name is Sheena Jain. I'm 28 years old. On 2nd of Jan, I fell down from staircase. लाइक पैर स्लिप्ड हो गया था. उसके बाद मेरा फुल बॉडी प्रेशर मेरे लेफ्ट हैंड पे आ गया था, एंड वो आ गया था एल्बो पे. बिकॉज ऑफ डैट मैं मेरा एल्बो या हैंड कुछ भी मूव नहीं कर पा रही थी. सो मैंने बहुत सारे डॉक्टर्स को दिखा दिए थे, लाइक 4-5 डॉक्टर्स, बट कुछ भी लाइक नहीं हुआ. 2-3 मंथ्स ऐसे ही निकल गए. देन फाइनली आई गॉट a suggestion of Dr. Mohit Kukreja from internet. I searched, and then I came here to take suggestion from doctor, like what he say. So he was like कि पहले आप 15 days physiotherapy करके देखो, and उन्होंने एकदम properly सब कुछ समझाया, and he is the best doctor I can say, because उन्होंने एक चीज़ properly समझाई थी. Now I can use my hand 95%. लाइक 5% थोड़ा अभी भी है, बट अभी भी फिजियोथेरेपी चालू है, सब कुछ है, बट लिटरली आई कैन यूज़ माई हैंड. एंड वन मोर थिंग, आई एम द लेफ्ट हैंडेड, एंड मेरे को लेफ्ट हैंड पे एक्चुअली लग गई थी, तो बहुत प्रॉब्लम हो रही थी. सब लाइक कांट इवन बेसिक चीज़ें भी नहीं कर पा रही थी मैं मेरी. ऐसे ही 2-3 महीने निकल गए. मैंने डॉक्टर को सब कुछ बोला, एंड ही इज़ वेरी पोलाइट, ही इज़ वेरी अंडरस्टैंडिंग कि क्या प्रॉब्लम है, क्या है पेशेंट की प्रॉब्लम. आई कैन हाईली रिकमेंडेड टू एनीवन हु हैव द एल्बो या शोल्डर सर्जरी, या फिर लेग का कुछ इशू है, नी का कुछ इशू है. ही इज़ द बेस्ट डॉक्टर आई कैन से.